Good afternoon, and thank you for joining us for our weekly update. I'm very pleased, as always, to be joined by Dr. Lawrence Lowe, our Chief Medical Officer of Health, Darren Rizzi, our Fire Chief, and our Director of Emergency Management, and as well today, a very special guest, Dr. Dante Moore, who is the Chief of Medical Staff at Trillium Health Partners, who is going to be speaking a little bit about the situation facing our hospitals, as well as the vaccination efforts underway at Trillium Health Partners. On behalf of the City of Mississauga and the members of my council, I'd like to extend my very best wishes to the Christian community on a very happy Easter. I'd like to thank all our religious communities for your sacrifices throughout this pandemic, and I'd also like to remind the public that our places of religious worship have a capacity limit of 15%. Because it is Easter weekend, many are asking that you register in advance to attend your Mass. Monsignor Owen Keenan, I'm looking forward to seeing you on Easter Sunday at noon. I'm registered. I'm now going to jump into my COVID update for today. We are seeing COVID-19 case increases rise in Peel region by 20% for the second straight week. This is very troubling, and we are seeing this happen right across the province. Peel region is now averaging 159 cases per 100,000, and it was 128 cases per 100,000 last week. Mississauga is now averaging 112 cases per 100,000, and that is up from 97 last week. Just 3 weeks ago, Mississauga was averaging 63 cases per 100,000, and I was very hopeful at that time we might go into the red zone, but things have changed very quickly. We know that these numbers have a 2-week lag, meaning that what we're seeing now is a reflection of what was happening 2 weeks ago in our communities. The R factor, which is the effective reproduction number, or how many people each person can infect, is and that tells us, that is the rate that tells us which how many residents how many infected residents will infect others. So with the region now averaging 1.11, down from 1.13 last week. Mississauga is averaging 1.05, down from 1.18 last week. And while these numbers have dropped slightly, it does mean that every person who tests positive and is infected with COVID will still infect at least one other individual. Any value over 1 is high and could lead to exponential growth. We are very worried about this trend, and we're at a very critical juncture at this time now as well. While our hospitals have been holding their own for the last few months, the situation is increasingly becoming very concerning. Trillium is currently at 103% capacity, dealing with 62 COVID hospitalizations, 15 patients in the ICU, and another 45 suspected cases. Trillium is once again transferring patients to neighboring regions and has been forced to set up a pandemic response unit at the hospital as a result of the growing number of cases. Brampton's William Osler Hospital currently has 97 COVID hospitalizations, 12 patients in the ICU, and another 64 suspected cases. On a more positive note, we are seeing fewer outbreaks of the virus in our congregate settings due to our vaccination efforts, with only 3 long-term care homes, 2 retirement, and 1 group home currently in active outbreak. There is also promising reports that COVID-19 rates in people 80 and older are also declining as more and more of them are getting vaccinated. This is strong evidence that the vaccine is doing its job, and that is why everyone needs to get theirs when they are eligible. However, we are seeing more cases of COVID in people in their 30s and 40s, and they are being hospitalized with more severe symptoms, which are quickly progressing into more critical phases. The rate at which the new strains are infecting our younger people is alarming. While cases are going up, we are rolling out more and more of the vaccine. Peel is finally receiving the numbers of doses that we need, and throughout the month of April, we expect to receive more than the provincial average. This increased supply is critical, and we continue to be one of the hardest hit regions in the entire country, representing more than 20% of all COVID cases in the province. Canada also received an additional 1.5 million doses of the AstraZeneca vaccine yesterday, which means approximately 600,000 doses for Ontario. It is my hope that we will begin administering these doses in pharmacies throughout Peel Region very soon. This will allow residents in Mississauga aged 60 and over to receive their vaccine right in their own neighbourhoods. I have been advocating for several weeks now that Mississauga and all of Peel participate in the pharmacy pilot. So I'm very pleased that the province will be expanding the program to the region of Peel. While Peel remains in the grey lockdown zone, the province has allowed for the opening of outdoor dining and the loosening of restrictions around outdoor and recreational activities. While I support these changes, it is also becoming increasingly important that our residents follow the guidance of public health. That means if you are visiting a restaurant, please do so with only the members of your immediate family. And if you are participating in an outdoor fitness class, please make sure you are safely physically distanced and are following all the protocols, including proper masking. I also am encouraged to see the increase in the delivery of vaccines to Peel Region. We are now getting thousands of vaccines in arms every single day. Trillium Health Partners has administered over 60,000 vaccines to date, averaging 2,600 per day with a goal of 3,000 per day by the end of the week. And in total, Peel Region has administered almost 130,000 vaccine. That's Peel Public Health, rather. Currently, all residents 70 and over are able to book appointments at the mass vaccination centres run by the region of Peel, run by Peel Public Health, rather. I'm excited today that those 65 and older are able to book an appointment at Trillium Health Partners and at the UTM sites. That's 65 and older, so there has been a change recently. And I'm sure Peel Public Health will be moving to 65 from 70 very soon as well. Please visit Peel Public Health website to book a vaccination appointment or for information as it becomes available. And that's at peelregion.ca. Peelregion.ca will have all the information about the coronavirus or how to book and register for your vaccine. If you don't have access to the internet, you can call Peel Public Health to help with booking with an appointment. And their phone number is, and I'll say it twice, 905-791-5202. That is 905-791-5202. My council and I have become increasingly hearing from residents about the confusion surrounding who is vaccinating, and by whom I mean which region is vaccinating which age group and where. Halton and York, for example, announced that they'll be starting vaccinations of 65 plus yesterday. The rest of us were at 70 plus. We just found out that the hospital locations in Peel are moved to 65 plus this afternoon, and that's very good news. And all the while, the region of Peel vaccination sites and the City of Toronto sites are aligned with the province, and they are currently vaccinating 70 plus. So this does create a lot of confusion, but also raises questions about fairness. Why is a 65-year-old in Halton or York given priority over a resident in Peel? And people are still hesitant to register and get vaccinated. That is still an issue right across the province. We have the capacity to vaccinate thousands of people each and every day, and we want to see all of our appointments fully booked. We'd like to see full registration for each of our vaccines. We've also heard in some areas, not in Peel, some areas that vaccines are going to waste at the end of the day, and we've heard that in different areas across the province. So we can't afford to have unfilled spots or vacancies or vaccine wasted. And that's why, along with the Mayor of the City of Toronto, Mayor Tory, we're calling on the province to lower the age of eligibility for vaccination across the entire DTHA, including Hamilton, yes, to those 60 years of age and over as soon as it is physically possible. Ideally, this should take in effect in time for the Easter weekend. I'm also continuing to advocate that the province prioritize vaccines for the more than 300,000 vulnerable employees who work in our warehouses, our manufacturing centres, food processing, packaging, and our distribution facilities. Included in this list are our transit workers, who across Peel have seen an increase in positive cases and have had outbreaks. Our essential workers in Peel have been critical to keeping the economy of this province and in reality of this country up and running throughout the pandemic. And they continue to shoulder a disproportionate amount of the risk. So getting our essential workers, those vulnerable as I described, our transit workers, our police officers, our grocery store workers, getting them vaccinated as soon as possible is not just the fair thing to do, it is the right and moral thing to do. A couple of weeks ago, the province modified the rules around gatherings in places of religious worship, allowing for 15% capacity if a proper social distancing, physical distancing can be maintained. I know that this was very welcome news for so many of you. I'm really looking forward to going to Mass on Easter Sunday along with my parish over at Merciful Redeemer. But because our numbers are rising and how precarious this situation is, we all have to adhere to the public health measures that are in place. We have to strictly maintain safe physical distancing as well as mask wearing when attending a Mass or a religious service. And I'm urging all of you to please not to gather with anyone other than your extended family. Sorry, I'll do that again. Please only gather with your family, not your extended family and friends this holiday weekend. Limit those interactions to those in your household. I know this is a hard ask, but we are at a critical juncture right now, and we need everyone to remain absolutely vigilant in this final home stretch. Brighter days are ahead, but we have some power in determining how soon those brighter days will come. So we have to continue to listen to the advice of public health. It is so important right now as we see case numbers increasing. And now I will invite Dr. Lowe up to the podium to please provide his update. Dr. Lowe?
Thank you, Mayor Crombie. Good afternoon. Mississauga's weekly incidence rate for COVID-19 currently sits at 111.6 cases per 100,000, up from 97.7 cases per 100,000 last week. Test positivity is at 8.8%, up from 7.6% last week. I want to start with a strong plea. If you are eligible to be vaccinated, please go get vaccinated now. Our supply is growing, and more appointments are available each day in the region of Peel. We are ready for you. Please come and get your vaccine. Tomorrow, our 3 hospital-run sites at Trillium, William Osler, and the University of Toronto Mississauga will move to offer limited appointments to residents who are aged 65 and over. Our 6 community sites at the Region of Peel's headquarters at 10 Peel Centre Drive and 7120 Hurontario Street, Paramount Fieldhouse, the Save Max Sports Centre in Brampton, the International Centre in Malton, and Caledon East Community Centre will continue offering vaccination for those 70-plus, Indigenous, and working in health in our community, with the hopes of also moving to a lower age bracket where the provincial system permits us to do so. For information on how to book appointments at all of our sites, I encourage you to visit peelregion.ca/COVID-19 vaccine for more information on eligibility and what to expect during your appointment. Those without internet access can access booking assistance at 905-791-5202, again 905-791-5202, from 8 a.m. to 8 p.m. 7 days a week. Please be patient if you call, as wait times can be long. Though we are working as quickly as possible, we want to get things right for those who are eligible and ensure that they get booked for their appointments. Vaccines in Canada that have been approved are safe and effective, and they are our way out of this. They will allow us to return to an opportunity to loosen measures for good, but it will take a critical proportion of us being covered to get us over that threshold. So please, to determine your eligibility and to book your vaccination, visit peelregion.ca/COVID-19 vaccine. I remain hopeful that more groups, including 60-plus, will become eligible in short order to extend crucial protection further into our community. My strong plea is rooted in another observation. We are seeing a return to sustained case growth and hospitalizations in the region of Peel. Peel Public Health has again streamlined our contact tracing processes to prioritize timeliness, and our hospital partners have opened their field units and are continuing to transfer critically ill patients to other hospitals. Our numbers are concerning, and they do not support further changes to the measures at this time. Province-wide, our situation appears grave, and I believe strong action needs to be taken to ensure that we keep everyone safe and that we reduce risk and the threat that faces us with the continued growth of cases and the variants of concern. We are fortunate that in the region of Peel, that remaining in the grey lockdown category of the provincial framework has helped to blunt the case growth with those measures in place. But it is clear that these measures have started to reach their limit in controlling our contact and interactions, and more patients, especially younger people, are showing up sicker and staying longer in our hospitals. What we do next is crucial. For those who can't reduce their contact voluntarily, such as our essential workers, we still require inspections, investigations, and protections, such as paid sick leave. I'm hopeful that increasing vaccine supply through Phase 2 will also allow us to reach this group as well as other priority groups sooner rather than later as the rollout continues. But for everyone else, it's crucial to remember that the pandemic is not over. Pretending that it is over will only delay our return to normal. We must go back to the basics with the changes and trends that we're observing. Please stay at home as much as possible. If you must meet someone that you do not live with for an essential purpose, prefer the outdoors to indoors, limit numbers and duration, and always distance and mask. Should you celebrate Easter this Sunday, ensure that you adhere to the public health measures and remember that the safest way to celebrate this weekend is to do so virtually. And finally, if you are sick, get tested and self-isolate. Do not go to work, do not go to school, do not go out and about in our community. Finally, most importantly, get your shot when your turn comes up as soon as possible without delay. Thank you, and I'll pass it back to Mayor Crombie.
And now I'd like to introduce Dr. Dante Moore to come up to the podium. Dr. Moore, this is your first time you're visiting us here for our update. Welcome.
Thank you, Mayor Crombie, and thank you for your leadership in the city and in our region. My name is Dr. Dante Moore, and I'm the Chief of Staff at Trillium Health Partners and the President of THP Solutions. Thank you for the invitation to share an update on what we're seeing in the hospitals. At Trillium Health Partners, we are working incredibly hard for our patients in the face of our third wave of COVID-19. We're also making significant progress on our mass vaccination program with the Peel region. Firstly, on behalf of the 12,000 staff at Trillium Health Partners, I'd like to thank this community for their continued support and the sacrifice they've been making every single day over the last year. We understand how difficult it has been for everyone. Throughout the pandemic, Trillium Health Partners has had some of the highest COVID-19 patient volumes in the province, and our capacity and the capacity of this region remains one of our greatest challenges. As you've heard, we are currently seeing a third wave of COVID-19. And as Peel region has reported, 46.4% of all the COVID-19 cases screened are positive for the variant. This is a major concern for the hospital. What we're seeing over the last several weeks is an increase in the number of COVID-19 patients at our hospital. As an example of this, just 2 weeks ago, we had 49 COVID positive patients as inpatients. Today, we are at 67. And the trend is not moving in the right direction. We're very, very concerned. 15 of these patients are in critical care, and 6 of these have the variant. We know that with the variant, they're more likely to need critical care during their hospital stay. We are in the third wave, and there's been a shift in the average age of patients. Now, 44% of our COVID inpatients are under the age of 60. It's important to understand why this is the case. First, it is a success of our vaccination program. We have vaccinated people in long-term care and our older population. This has been a significant improvement in people coming to the hospital. That shifts the age down. But the second is the variant is more infectious and it actually is more serious. And that's something that I think is really important that people hear. I think they understand the variant is more infectious or it transmits more, but they haven't quite heard that it actually is more serious when you get it. That means you have a higher chance of hospitalization, you have a higher chance of death, and a higher chance of being in the critical care environment. We are seeing people in our 30s who are sick. We're also seeing more visits to our emergency department. And these are patients with both COVID and without COVID, with higher admissions. So what that means is our capacity is under strain. And with our modeling and what we're seeing, we're very concerned about the patient volumes and the capacity in this community. We'll continue to work closely with our partners across the region to ensure that we have capacity to deliver safe, high-quality care. Last week, we began to admit stable patients to our pandemic response unit at the Mississauga Hospital. We are using this space as required to meet patient demand and maintain safe occupancy levels. While we work diligently to manage the increase in patient volumes, we are now seeing in this third wave that we can also share a message of hope, and that is around our vaccination program in Peel and at THP. Trillium Health Partners with the UTM group has vaccinated over 65,000 vaccines given, one located at the Mississauga Hospital and the other at the University of Toronto Mississauga campus. I want to thank our UTM partners and specifically Alex Gillespie for the partnership in doing that. We'll continue to work closely with our partners in Peel Public Health and William Osler to accelerate our efforts for vaccination. In the past 2 weeks alone, THP with our partners have doubled our scheduled appointments. We are now vaccinating 3,000 people a day. Today, as Dr. Lowe mentioned, aligned with William Osler, we are now inviting community residents who are 65 and older to book an appointment to be vaccinated. And we look forward to the continued opening of additional groups as we continue vaccine supply and the province enters into phase 2. We're working very hard to provide the quality care that you have come to depend upon at Trillium and within this region. And we're firing on all cylinders to vaccinate as many people as possible to end this pandemic. But as Dr. Lowe said, and I think this is really, really important, if you have the chance to get the vaccine, please take it. I can tell you as a healthcare provider, I've been vaccinated. The vaccine has incredibly great safety profiles. And I want to tell you why I got the vaccination. It's for many reasons. One, to protect myself. As a physician, I want to protect myself. Number two, to protect my community. Number three, to protect the patients that I see. And number four, to protect people that I love and care about. If you have the chance to get the vaccine, please take it for any one of those 4 reasons. It's incredibly important, and it is our way through the COVID-19 pandemic. Thank you very much, Mayor.
Thank you, Dr. Mora, and now we're all prepared to take your questions.
Our first question comes from Steve Cornwell at Mississauga News. Go ahead, Steve.
Hi, Mayor Crombie. How are you?
I'm very well, Steve. I hope you are as well.
I'm good, thank you. You mentioned today in Council that there's been an outbreak related to My Way. I'm just wondering, could you tell us some details on that, and if at this point there's any indication of risk to the public?
So there have been a number of cases, I think about 4. I'm going to ask Dr. Lowe to respond as well. And anyone in close contact with those individuals was sent home. And I do believe that one of the individuals that tested positive has now been hospitalized. Dr. Lowe, do you want to make further comment? Thank you.
Thanks, Madam Mayor, and thank you, Steve, for the question. I can confirm that Peel Public Health is investigating a cluster of cases at a workplace that is associated with My Way in Mississauga. It has not been officially declared an outbreak at this point in time, and at this point in time there is no indication that there is any broader risk to the public in our initial investigation. But again, this is a cluster of cases. We're continuing to investigate, and certainly we will provide information as it is appropriate, but I can't confirm that investigation is taking place. Thanks.
Follow-up question, Steve?
And Mayor Crombie, just based on, as we're heading into Easter weekend here, there's lots of comments said about kind of, this holiday and trying to be safe through it. Are you concerned at all that there could be, just based on how holidays have happened in Peel historically, there could be a kind of spike in cases, and if there is, that seems quite serious at this point with the numbers as they are.
Steve, we have seen these holiday weekends with families gathering, extended families being invited as super spreader weekends. We do see and we will see an increase in cases 2 weeks following Easter. That was the pattern after last year, Easter, after Thanksgiving, after Christmas, etc. So in fact, we do see the direct result of people gathering 2 weeks after the event. So we are very concerned, and that's why we're asking you to please heed the warnings of Peel Public Health. Please only celebrate with your immediate family, and that is the individuals that you live with. Please keep your celebrations to online and practice the public health protocols, if you will. I know I will be going to Mass. There is a hard cap on the number of people that can attend, and we all had to pre-register, and I know we'll have allocated seats, etc. So we will be practicing all the safe protocols at our Easter Mass on Easter Sunday as well. And I also know that many of the churches have not been the source of the spread of transmission in the past.
Our next question comes from Ashley Newport at Mississauga News. Go ahead, Ashley.
Hi, Mayor Crombie.
Welcome, Ashley. Thanks for joining us.
Thank you. So I wanted to mention something. A comment came up today at a general committee. I believe it was from Councillor Sato, and she said that there still seems to be slow uptake in vaccination from seniors. I think she mentioned specifically over the age of 75. And we know that seniors over the age of 70, City of Toronto has had some trouble getting enough people to sign up and fill vaccine appointments. So obviously, like you said earlier, it does seem that older residents who do want vaccines are kind of confused about how to book an appointment. So I'm wondering if the city or region is using non-electronic means to communicate with older residents, like is Peel Public Health maybe phoning people directly or sending flyers in the mail? Is it possible that the region or city is already doing this, or looking into getting family doctors' offices involved and calling elderly patients directly and walking them through the process? I'm just kind of trying to find out maybe what might be behind this and what solutions there might be.
So you raise an interesting problem, and yes, of course, it's always a challenge to reach our residents. And as I mentioned in my remarks, there is a lot of confusion because different regions are vaccinating different age cohorts, different age groups. So it does create a lot of confusion. There has been a pilot program that we have been participating in with primary care providers who have been calling their residents, their patients rather, 60 and up, and that has been quite successful. I know people have a lot of comfort in receiving their vaccination from their family doctor who can advise them which is the best vaccine for them, right? They like to consult with their family physician. There is a phone number to call if you don't have internet access. I'll give it to you now 905-791-5202. And yes, of course, Public Health has a campaign underway to create awareness on how to get vaccinated and encourage everyone who is eligible to please go out and get vaccinated. So maybe I'll ask both Dr. Lowe and Dr. Dante Moore of Trillium Health Partners on what efforts they each individually through Peel Public Health or through Trillium Health Partners have undertaken to create better awareness of how to get vaccinated, whose turn it is, and why everyone should get vaccinated as soon as possible. Thank you, Ashley. Over to Dr. Lowe.
Thank you very much, Mayor Crombie, and thanks, Ashley, for the question. Actually, in fact, our numbers in uptake have been very good. I'm happy to share that 2/3 of our 80-pluses have already received their vaccination, with many more scheduled for the next little while. And I'll also highlight that our 75 to 79, very significant proportion, they've only been open for about a week and a half, but they're over 50% done. So I would, suggest your characterization that we're not getting people in. I mean, that's tens of thousands of people in those age groups that have been vaccinated by Peel Public Health, and together with our hospital partners, with many more booked in the days to come. We obviously are working through a number of community engagement tables, getting the word out through ethnocultural groups on social media, and certainly we've also, in addition to the pilot that Mayor Crombie mentioned, we do have that booking line that's available. There is trans help available for seniors who may need a little bit of assistance to get to a vaccination site, and we are in the process of finalizing the details of how we're going to reach homebound seniors. So, Ashley, I think there is a lot of work being done to make sure that no seniors are left behind, and I'm very proud of the numbers and the work that we're continuing to do there. Thanks for the question.
Thank you. I'm just going to echo Lauren's comments. We are actually seeing really good uptake of over 70 and over 80 populations, and a lot of push through social media and our media outlets, and through family doctors and some of our specialists. So I think there's just a reality of we're actually vaccinating large swaths of the population now. So we just have to move through the population to be able to deal with the operational capabilities of the Peel Public Health units and the hospital units. And I think we are making a lot of progress in the different groups.
Next
Ashley,
question,
do you have a follow-up?
Thank you.
Oh, yes, I do have a follow-up. I wanted to also touch on about how earlier today at this press conference, Dr. Morris said that we're seeing, I think he said over 40%, correct me if I'm wrong, patients that are being treated for COVID in hospital are under the age of 60. If, this is the case and we're starting to see more severe cases in, much younger people, I know that now Peel seems to be moving through the vaccine demographics relatively quickly. Like today you announced you can do over 65, and hopefully that could change to over 60 in the near future. Does Peel Public Health have the ability to blitz vaccines to younger people who might be getting sick? Because I don't know about the demographics of the people getting sick who are younger. Are they mostly essential workers? Are they people who work in these workplace settings that have been prone to outbreak? Is there any way that Peel Public Health can decide, okay, now we're seeing a crisis in our hospitals, we're seeing continued crisis in our workplace. Can you direct vaccine to these people without the province's permission, or is that not possible?
Yeah, unfortunately not. I'm going to ask them both to respond, but as you know, the province has set up the framework and has set out the phased rollout of the vaccine, and all those people that you described will be vaccinated in phase 2, I think beginning of June, but perhaps we'll get there sooner because we have been meeting our targets ahead of schedule. So we have been advocating to move to 60 plus today, right across the province, and we've been advocating now for a number of weeks that all those vulnerable people in those essential jobs in our manufacturing, distribution, etc., not to mention as well as our educators, our transit workers, grocery store workers, etc., be on that priority list as well. So why don't I ask both Dr. Mora and Dr. Lowe to come and comment, but unfortunately we have to follow the guidelines set out by the province, and I believe people with underlying health conditions are included in now phase 2 as well. Over to you, Dr. Mora.
Thank you, Mayor. So what we're doing, the guidelines work. So what we're doing is we are vaccinating the people who are at the highest risk. Those are high-risk patient populations, cancer patients, hemodialysis patients, the elderly in long-term care. And so that's actually working really well. And what we just simply need to do is keep moving down that risk profile. And that's the strategy. The strategy is working well, and we'll continue to advance that strategy. What we're seeing, though, is with the variant, we do see more transmission, and that's into that younger population. But we shouldn't change what we're doing to then chase that as we move forward. So I think the key point is we're moving through the population, we're moving through it with the right risk-adjusted framework, and we're delivering more and more vaccine, and now we're opening up more populations, and those higher risk populations are going first.
Yeah, so thank you, Mayor Crombie, Dr. Mora. Ashley, the province's prioritization framework outlines three main goals, and the first is to reduce mortality, second is to reduce severity of illness and hospitalizations, and third is to reduce risk of exposure. And so for that reason, the province has therefore adjudged certain groups within certain phases, starting with the oldest and those with the underlying health conditions, as a priority for vaccination. And so that's why the priority list is the way it is right now, based on those three categories. And one thing I forgot to mention in my other answer to your other question, in respect of individuals who are 75, another thing that I would, 75 and older, 70 and older, 65 and older, my encouragement to everyone is if you know a senior citizen out there who might need a little help booking or need a little help getting to an appointment, you know, we've looked out for each other throughout this entire pandemic. Please lend a hand, reach out to them, see if they might need some help getting some vaccine. So thanks very much for the questions, Ashley.
Next question, please.
Our next question is from Nita Zafar from The Pointer. Go ahead.
Welcome,
Hi, Mayor
Nita.
Crombie. How are you?
I'm so well. How about you, Nita?
Thank you. I am good, thank you. So my questions are for Dr. Lowe today.
Okay, no problem.
Dr. Lowe, you mentioned, thank you. Dr. Lowe, you mentioned supply is growing. Can you provide specific numbers to show how? And can you also detail how many vaccines are left to be used in Peel at this time?
Thanks very much, Nita. I don't have those numbers offhand, but you can speak to Ashley in our communications office and she'll be able to provide you those specific data. We do publish the doses that have been administered online on our website on a regular basis, and we do provide allocation numbers upon request to media outlets that inquire at our communications bureau. So you can ask Ashley.
Thank you, Dr. Lowe. My follow-up is also for you, Dr. Lowe. So is Peel Public Health adjusting their monthly vaccine targets, or is it still 500,000 doses to be administered in April?
Thanks, Nita. The information that was provided in that schematic and framework was based on the originally described allocation timelines that were published by the federal and provincial governments. As you know, there have been significant changes in production, delays, etc. So I think to the extent that our communications bureau will be able to provide you with the most up-to-date numbers, making sure that I am accurate. And the reason is because the numbers do change literally day to day, depending on when an allotment is received or when an allotment is dispatched, and depending on the numbers that are seen in clinics. You'd be best to speak to the Communications Bureau about any numbers, certainly now and in the future. Thanks for the questions.
Next question, please.
Our final question today comes from Khalid Salama from My Second Home TV. Go ahead, Khalid.
Welcome, Khalid.
Thank you. Welcome, Mayor. Thank you so much. Actually, I want to know how many doses wasted or not used because of either vaccine hesitancy or people didn't show up of the designated age brackets.
Yep, absolutely. I'm going to ask both to come up again. I think very few have been wasted in any way here in Peel region. I think they do have a backup call list of people who could come in at the end of the day so that the vaccines aren't wasted. There only has been lag when the province has announced a different age cohort, a different age category, and then people are slow to realize the age change and book for their appointment the next day or two. So there has been a few vacancies with appointments, but no, they will tell you, but very little waste of vaccine. Dr. Lowe?
Yes, thank you, Mayor Crombie. Thank you, Khalid, for the question. Because of the no waste policy, the vaccine is essentially prepared and distributed in real time in the clinics to really cut down on potential waste at the end of the day. So the amount of doses that are left unused at the end of the day are really kept to a minimum. In terms of a standby list or a call-out list, there had been, at least for the Peel Public Health clinics, a limited standby and call-out list, again, recognizing that there were very few doses at the end of the day, and that was used more internally. However, as allocations do continue to increase, we do recognize that there is interest in particularly getting certain priority groups for what we may see as increased numbers of doses left at the end of the day, and I'm hopeful that we'll be able to share more information on what that system will look like in the days to come. So thanks for the question. I'll pass it to Dr. Mora.
Thank you, Dr. Lowe. I can assure the public here that we have had no wastage of dosages because we have residual dosages at the end of the day. So we've given 65,000 dosages of vaccine. We always have residual people to call in, and that's not an issue. There is the odd, and we're talking like very, very unlikely where if there's a draw error, but these are like in the 1 in 100, like 10,000 rates, and it just has to do with how you're giving medications. But this isn't an issue for the UTM and THP clinic, and I know we have a lot of processes in place to make sure that the public is completely knows that we're not wasting vaccine.
The follow-up would be with the hospitals right now at capacity and the intensive care units as well. Why shouldn't we consider establishing like field hospitals with even not that 100% qualified medical personnel in case we need them, in case number will surge more?
So I'll ask Dr. Moore, because I believe you have set up a pandemic response unit, correct? It's on the surge clinic, the surge unit, a field hospital. Dr. Moore is going to come up and respond to you, Khaled.
Thank you.
Thank you for the question. Actually, at Trillium Health Partners, we do have a pandemic response unit that was built early on in the pandemic. We are using that for our stable patients. So we are starting to access some of that capacity to respond to the needs within the community.
Next question.
That concludes our Q&A for today. Thanks for joining.
Thanks very much for having us.